are back. Good morning once again. I think it's safe for me to say that, right? Okay, because I know that some person just join us for the first time. They've been not joined the breakfast show, but guess what? It's still the breakfast time on top of your #1 family entertainment channel. And today's Saturday. I told you guys for 8:30, Dr. Bago they here. I'm going to talk about waiting they very, very important. Waiting they affect the entire world. Yes, waiting we feel say okay, we don't they get breakthrough with, but all of a sudden they come back in terms of numbers. I get a lot of questions to ask Dr. Bat this morning. Why we don't they celebrate and then all of a sudden the surge, the return? Is it that we stopped doing what we were doing, or is it that it can never be a forgotten story? Ladies and gentlemen, Dr. Bat is in the building, and after so many months, I cannot remember last month I was on this set with you,
of them all.
Doctor. Good morning.
Yeah.
Should I say Happy New Year?
I'm glad to be back. Thank you very much. You're looking sweet as always.
Thank you. You look good too, as
yeah,
always.
Thank you very much. Good morning, viewers at home and around the world. This morning we'll be starting with coronavirus pandemic updates. And I want to start by saying that it is not all gloom and doom, okay? There appears to be a light, after all, at the end of the tunnel. Why am I saying so? A major breakthrough has actually been made, okay, in our fight against COVID-19. I'm talking about no other breakthrough than the fact that a vaccine has been discovered. A vaccine has been found. Should we be happy? Yes, we should be happy. Okay, it's an array of hope on the horizon. Now, why am I saying so? It's not because before now we have not heard about as a matter of fact, the vaccine tracker from New York Times shows that before now, that 6 vaccines have actually attained emergency authorization status, okay, approval, not the formal approval. At the moment, none of the vaccines have been approved, okay. But why is this news from Pfizer and, of course, BioNTech? Pfizer, of course, is an American pharmaceutical giant, okay. So they've been able to announce their own results. Okay, I want to say that they've been in partnership with a German company, BioNTech, precisely. Okay, now the good news is that their own vaccine candidate has been found out to be at least over 90% effective. Okay, I can tell you that if any of the vaccine candidates that have undergone successful trial, any of them that is able to achieve as much as 50% is actually a welcome development. Okay. But to have a vaccine that can give over 90% effectiveness, okay, is a major breakthrough in the fight against COVID-19. Suffice also to say that this vaccine candidate at the moment has not gotten an emergency authorization approval, okay, but we are looking forward to having that in the coming weeks, expectedly. The world is expectant. And I must also point out that this vaccine at the moment has not been peer-reviewed. So the data that has been made available to the scientific community was actually the data from the manufacturer. So it's until it is peer-reviewed. Of course, when that is done, we should expect to have a formal approval. But the good thing is that before the end of this year, a good number of people will start getting vaccinated. That is not to say that a number of people have not been vaccinated before now, but of course, they were part of the people that volunteered for the ongoing trials that are happening in a number of countries. That said, I want us also to draw our attention to the fact that the coronavirus pandemic is surging higher and higher by the day. As a matter of fact, the records we have at the moment, take US for instance, in the last 5 days, they've charted the pre-existing daily new records. Okay? Now, in the last, let me start by looking at the global caseload. Okay? At the moment, coronavirus has affected, COVID-19 precisely, has affected 53,747,020 persons across the globe. And of course, it has caused over 1.3 million deaths. Suffice also to say that 37,524,179 individuals have recovered from this COVID pandemic, from this COVID contagion. Okay, and we do know that a number of countries have started experiencing a second wave. Forget about the terminology. A number of countries at the moment are experiencing much higher figure than they've actually witnessed since the COVID pandemic started. For instance, US recorded in the last 24 hours, US recorded 183,527 new cases in just one day. Okay, and at the moment, over 11 million people have been affected in the US. A number of countries, 10 different countries have actually gone past the 1 million green milestone. Okay? As it stands now, India has about 8.7 million infected individuals. Brazil has seen over 5.8 million infected individuals. France has seen over 1.9 million infected persons. Russia has seen over 1.8 million infected people. Spain has seen over 1.4 million infected persons. UK has seen over 1.3 million infected persons. Argentina has seen over 1.2 million infected individuals. And of course, Colombia has seen over 1.1 infected persons. Italy has seen over 1.1 million infected persons with COVID-19. Okay? Mexico is knocking on the door, 991. But let's bring it a lot closer home. Let's look at what we have in African sub-region. Okay? At the moment, South Africa, of course, stands at number 1 slot in the whole of Africa. Yeah, thank you. The caseload in South Africa is currently 748,945 persons. And in the last 24 hours, South Africa has seen 2,213 new cases. Okay? Now, you can agree with me that the figures we are seeing, if anything, has shown that we are having an uptick in the number of cases that we are seeing on global level. Morocco comes second in Africa, okay, with 282,336 infected individuals. And the new cases that they recorded in the last 24 hours was over 5,515. And of course, you have Ethiopia, Tunisia, Libya, Kenya, Algeria, and Nigeria at the 9th slot. Okay? Nigeria, so far, we have seen 64,884 infected people in Nigeria. And in the last 24 hours, Nigeria has recorded 156 new cases. 156 new cases. Okay? I also want to take a quick look at the statistics we have in Nigeria from the 1st of November till today. Okay? Let's look at the number of new cases that we have seen in Nigeria starting from the 1st of November. 1st of November, the number of new cases that were recorded in Nigeria was 111. 2nd of November, we saw 72 new cases. 3rd of November, the caseload was 137. And of course, on the 4th of November, Nigeria also recorded 155 new cases. 5th of November, we saw 180 infected people. 6th of November, it jumped to over 223 persons. By the 7th of November, we got 59 new cases. 8th of November, the highest we have seen in November, 300 new cases were recorded. And of course, on the 9th of November, Nigeria recorded 94 new cases. And 10th of November, we saw 152. 11th, we saw 180. On the 12th of November, we recorded 212 new cases. And of course, overnight, we have seen 156 new cases. Now, if you take a close look at this figure, you can actually see that they're not following a particular pattern. And of course, why is this so? The more we test, the more we will discover, okay? Those days that we actually witnessed fewer number of cases, for instance, on the 7th of November, when we had 59 new cases, I can tell you that one of the major cities Lagos didn't actually report any case for that particular day. Okay? And at the moment, we hope to be doing a lot more testing than we are doing now, but unfortunately, that is not the picture yet. I can tell you that the federal, the molecular lab that are owned by government in Nigeria at the moment stands at 69, and you have 22 private labs to complement their efforts. So in Nigeria at the moment, we have about 91 labs that can independently test for COVID-19. And with this huge number of labs, we ought to be doing better than we are doing now. What is going on is the fact that we are beginning to lose our guard. You discover that some of the public health measures that were that people implemented over time in churches, in supermarkets, in a number of event centers, we are beginning to lose sight of them. In some places, you get to some places, and even if you want to wash your hand, you discover that what used to be there in terms of hand washing apparatus, have been taken away. And of course, people don't give people sanitizer to sanitize their hand. Now, the general belief out there is that COVID has gone. Unfortunately, that is not the true picture. Okay.
Some people don't even believe that there was COVID. Not even there is COVID.
Now, but when you watch the other news channels, international news channels, and you see what is going on in the world, you wonder. You begin to wonder. Of course, there are a number of Nigerians who are living abroad that succumbed to this.
The former president of Ghana actually died of COVID.
Exactly.
Anyways, we'll talk about that in a bit. We need to go for our first break. When we come back, Dr. Bag will continue on top where he stopped, and I think it'll be time for us to open the lines.
Thank you very much.
All right, so I'll be right back.
The federal government has announced new guidelines for international travelers coming to Nigeria, effective from September 18th, 2020. Before departure, all travelers coming to Nigeria must take a COVID-19 PCR test at an accredited laboratory in the country of departure not more than 5 days before boarding. Only PCR tests will be accepted. Travelers with a PCR test result of more than 5 days or 120 hours or with COVID-19 symptoms will not be allowed to board. Within 3 days before boarding, register on the Nigeria International Travel Portal. Complete and submit the health declaration and self-reporting form online with a valid phone number and address. Update information on diplomats and children under age 10 separately. Next, upload the negative PCR test result on the portal. Choose a sample collection center and then book an appointment date where the mandatory self-isolation will be observed in Nigeria. Payment for the repeat PCR test to be done 7 days after arrival is to be made online on the portal, after which a QR code access report will be generated. It is strongly recommended that payment be made online before boarding. Payment on arrival in Nigeria can lead to long delays before exiting the airport. For issues with payment, visit saferport.com, My Traveler Record. On arrival in Nigeria, passengers are required to undergo port health screening and present electronic or printout QR code evidence. Travelers developing symptoms on arrival or during screening will be placed in institutional quarantine for appropriate care. From the airport, proceed to the 7-day mandatory self-isolation and avoid all physical interaction with others. During isolation, be available by telephone, as travelers will be monitored by public health officers and should check their emails and text messages regularly for updates from the selected laboratory for their repeat PCR tests. On day 7, have samples taken for the repeat PCR test at the selected sample collection center. Passengers are required to provide a valid means of identification. Travelers who test positive for COVID-19 will be managed based on national guidelines for treatment. Those who test negative after 7 days can end self-isolation. Be advised that those who fail to repeat the PCR test by day 14 may face suspension of their passports, inclusion on a travel no-fly list, or be denied international travel for 6 months. Get 24/7 support. Please take responsibility. This message is from the Presidential Task Force on COVID-19 in collaboration with CACOVID.
Shoo! Una no dey wear face mask.
For wetin now? This one still think say corona dey.
Abeg, no mind am. You dey go abi no dey go? I no get time o.
Oga, COVID-19 still dey town o. Abi una no dey see the daily update for NCDC. Abeg o, make we dey wear our face masks because person wey get corona, e no dey show for body o.
Na true. But I don tire to dey wear this face masks.
Oga, I know plenty people wey COVID-19 don kill because the government don relax for this lockdown matter. No mean say make we sef relax on protecting ourselves o. If we catch this corona, we fit give our family member if we no dey careful. My country people, make we dey practice physical distancing, wash our hands with soap and running water, and make we wear our face mask every time.
Na true, my sister. Corona dey kill, especially old people like us. Now we dey at risk. Abeg wear my face mask. Make una wear una face mask o. From today, anybody wey no wear face mask no go enter my motor. No face mask, no entry.
There are a lot of false information about the coronavirus. These are the facts. People of all ages can be affected by the coronavirus. However, older people and people with pre-existing medical conditions such as asthma, diabetes, heart diseases are more vulnerable to the disease. It is not for old people alone. Gargling salt and warm water or chewing garlic and ginger cannot prevent the virus. Drinking alcohol, hot lemon, palm oil, or chloroquine will not kill the virus. The virus cannot be transmitted through mosquito bites. Antibiotics do not work against the viruses. Antibiotics work only against bacteria. Boiling pineapple peels, lime, and ginger does not kill the virus. Putting raw onions in rooms will not ward off the virus. Using or spraying Dettol, special oils, and water all over your body cannot kill the virus. There is no scientific evidence that cooking, drinking, or eating any of these is an effective treatment for coronavirus. Do not self-medicate and take responsibility by sharing only verified messages from health authorities such as NCDC, Federal Ministry of Health, and WHO.
How do I get tested? If you fall into any of these previously mentioned categories, remain in self-isolation and immediately call your state hotline or the NCDC toll-free line on the screen. The State Ministry of Health, supported by NCDC, will arrange for sample collection and transportation to the lab. Where can I get tested? There are several labs across Nigeria for the testing of COVID-19, and these labs are currently rapidly being expanded across the country to reduce turnaround time from when the samples are taken to when they are tested for the disease. And you can only get tested if you fit the criteria as previously mentioned, and a sample has been collected for testing by the state team. What do I do if my COVID-19 test is positive? If your result is positive, please do not panic. Many people who have the infection will show mild symptoms and they can recover quickly with just supportive care. And most of the cases recorded till date in Nigeria are mild to moderate and are clinically stable. What do I do if my COVID-19 test is negative? If your result is negative, it means that you are not infected at the time your sample was taken. However, it is still possible to get infected. Therefore, you should continue to practice social distancing. Wash your hands with soap and running water all the time. Use alcohol-based hand rub frequently and clean your environment all the time. Should I come to the Nigeria Center for Disease Control to get tested? No. If you fall into any of these previously mentioned categories, please remain in self-isolation and immediately call your state hotline or the NCDC toll-free line on the screen.
Hello, my name is Dr. Kenny, and I want to share some life-saving information with those of you above age 60, like me. At our age, we are at a much higher risk of severe illness and even death if we contract the COVID-19 virus. Also, those of us with underlying health conditions like cardiovascular disease, diabetes, chronic respiratory disease, cancer, and obesity also face the same danger. However, we can prevent and stop the spread of COVID-19 by ensuring we stay at home as much as possible. Wash hands with soap and water, sanitize hands and surfaces, wear face masks when in public, avoid crowds and maintain physical distance, and importantly, stay away from people without face masks worn properly over their nose and mouth. COVID-19 is endangering more and more Nigerians, so please protect yourself and others. Take responsibility. This message is brought to you by the Presidential Task Force on COVID-19.
This message is brought to you by, yes, Dr. Ba, I need to say a very big thank you for all of these packages, all of these videos.
Thank you very much.
Because they are very, very educative. There are things that when you watch, you learn from. Thank you. Because I know it's your busy schedule. Most times I try to understand how
we are taking responsibility.
No, you are always watching out for people. And that is really amazing.
Thank
all right,
you so much.
Of course,
I appreciate you.
So we're going to continue from where we've been stopped, but from infos that I'm getting, Dr. Ba said it's time for us to open the lines. All right, I need to open the phone lines so that you, when they watch us for house, you get questions to make, you get contributions to make. You are free to make all of that right about now. All right, so feel free to call those numbers on your screen, 08173147589, and of course 08105434984. For those persons who would like to see their faces, you can also call us on our Skype ID. You can see for yourself. WAP TV. Doctor, so, like I said, when I launched the show, I said, okay, so it got to a point where we started celebrating. We're no longer recording high figures. And we felt, okay, fine, this thing is dying. And then I became extremely happy again when they told me about the vaccine. They said, okay, we have vaccines now. So I was quite skeptical about it because I know it's not going to be readily available to a common man. And I know obviously it's going to be expensive. It's one thing for you to see, it's another thing for you to have the money to get it. But I'm never going to go into vaccine yet. Now, I want to ask, or I want to understand, why do we have the increase? Like, what happened? What's in the return the search, after the breakthrough I felt we had?
Thank you very much. That's a very good question. Now, over the years, in history, the closest that we have had, that humanity had experienced, talking about a pandemic of this magnitude with similar demographics, was sometime in 1918. Is that 1918 or 1920? I'm talking about the Spanish flu pandemic. Okay, so at that time too, face masks were worn by people. Even our forefathers. You can't imagine that.
We have Beleda. Beleda is calling me again. Bele, good morning once again.
Good morning.
Good to have you back on the show.
Yeah.
All right, you get questions?
I have a question.
Turn down your volume. Turn down your TV volume.
I've done that.
All right, go on with your question.
My question is, if you notice the symptoms from a close person near you, do you avoid the person or you encourage the person to call you guys?
No. Call doctor, not sleepy.
Thank you very much.
Thank you
very much. One of the short clips, video clips that we watched.
He said, should I come to the NDC? He said, no.
Should I come to NCDC?
That no was immediate.
And of course, the answer was no. Now, that was on a lighter note. What to do is actually to reach out to your state hotlines. Your state first. Very important. Okay, so the state hotline is the number you should call first. Okay, once you call, you're expected, if you or someone around you, okay, that you suspect the person may be having COVID symptoms. Of course, we know what these symptoms are, but I will do a recap. Difficulty in breathing, cough, and of course, fever, runny nose, recent loss of taste, a recent history of loss of sense of smell or taste. Okay, these are pointers that this person could be having. For all you care, it could be having COVID. Okay, so what to do is to ensure that the person is quickly and promptly isolated, and then you call those numbers. Apart from the numbers, there are also some Yes, that's some of the contacts that you can actually reach out to. Some you do WhatsApp, some you send SMS. Okay, so once you do, someone will take it off from that end. Okay, and they will instruct you on what to do. But on that note, I also want to say that unlike what we had before, mild cases are presently being managed in the communities. It's only moderate to severe cases that will require hospitalization. Of course, I was trying to look at the figures from Lagos State, and I realized that less than 50% of people are currently on admission for COVID-19. Okay, so it is also a well-known fact that Nigeria is a country that is made up of largely a youthful population, and that accounts for the reason why we are not seeing the devastation as much as we are seeing abroad in the country. Okay, so the numbers to call are your state hotline. That is the starting point.
Okay.
Now, coming back to your question,
Yes,
why the second surge? So in history, the Spanish flu pandemic that happened many years ago, they actually had a second wave.
Oh.
Okay, so one of the things that can actually push or make it possible is when people stop adhering strictly to public health measures. Okay, so we do know that in the US, because of their recently concluded elections,
they all came out.
Yes.
But then they had their masks on, because I watched.
No, not in all
Wasn't
places.
enough.
Not in all places. Not in all places. Ostensibly because there were issues around wearing of masks. A number of states had mask mandates in place, while some others did not. As a matter of fact, the whole thing was politicized at a point. Talking about the public health measures were being politicized, and of course, it ought not to be. And of course, look, if you see what is happening in the US today, you'll be wondering, could this be somehow, in as much as nobody will want to say that, of course, this thing was brought, that anybody brought this on any particular nation, there are measures, established measures. For instance, I've seen a number of comparisons. South Korea had reported cases at about the time that US reported cases. But if you look at what has happened in South Korea and compare it to what has happened in the what has happened in the US, you discover that there's a world of difference. Now, this particular nation, they adhered strictly to public health measures. As a matter of fact, if you flout any of those, of course, you will pay a price or probably get arrested. But it wasn't so in a number of Western nations, okay? So, and of course, we are seeing the consequences. Even in the first wave, they never had cases as high as what we are witnessing today. So records have been charted in terms of the number of cases, new cases, and charted over again. Okay, so that is what can happen when people begin to flout or disobey public health measures. So we are still encouraging Nigerians, wherever you are, Africans, the whole of humanity, please ensure that you adhere strictly to public health measures. They have been shown to protect and prevent COVID-19. Remember, prevention, they say, is always better than cure. Okay? Don't even think that, yes, they said they've discovered the vaccine. I can tell you that the vaccine that has been making waves, that was announced on the 9th of November, was not even among the six vaccine candidates that have actually attained emergency approval. What happens is that any country that considers its own vaccine candidate effective enough, the country can actually go ahead and give them an emergency authorization. Okay? That does not mean that WHO has actually pre-qualified such a vaccine. So we've seen about 6 of them before now. If the vaccine candidate from BioNTech and Pfizer gets emergency authorization, it will actually become the 7th one. Okay, but why is there so much noise about their discovery? Is the fact that in terms of their trial, the what we call sample size, the number of people that participated in the trial is actually the highest that we have seen so far. Okay, and of course the effectiveness that they said is over 90%, and almost all of them. Permit me, suffice also to say that this vaccine candidate from Pfizer is a messenger RNA-based vaccine, okay? Moderna is actually working on something similar. So in no distant time, we might be seeing another vaccine candidate that may come out with similar similar statistics. Okay, so now let's also go to this vaccine. Just like what you rightly pointed out, if these vaccines are made available, how many countries of the world, okay, will it get to at this immediate time? In the US, FDA hasn't approved this. Okay, they are speculating that this could take about, for them to do their own reviews and findings, that it might take in the neighborhood of 1 to 2 weeks for FDA to actually do their own reviews and, of course, give an emergency authorization for these Pfizer vaccine candidates. Now, when that is done, that should be getting into second half of next month. Okay, so we might actually see from
next year.
Yes, yeah. Because what American president actually said, that was by April next year, it will be available in commercial quantities. And also, do not forget that this vaccine has been booked.
Let's take Dan from Delta. Hello, Dan. Good morning.
Good morning, Mr. Dan.
Hello, Dan. It's gone. Okay. Please call us back.
I hope you can call us back. Okay, so now this vaccine candidate, okay, talking about the Pfizer vaccine candidate, there are a number of unique things about this particular vaccine. Number one is that the cold chain, transporting it from one place to the other, is going to pose a big challenge. Okay, so I think I have something here. In terms of, I want to read it out from here. Getting the vaccine from the factory to people's arms could pose some major challenges. Like Moderna's vaccine, Pfizer and BioNTech's preparation is based on messenger RNA, which falls apart unless it is kept in deep freeze. As a result, the vaccine will have to be chilled to minus 80 degrees Celsius, minus 112 degrees Fahrenheit, until it is ready to be injected. And as a result of this, Pfizer is trying to develop boxes that could help to transport this vaccine. Okay, so when you're talking about minus 80 degrees Celsius, they have to devise newer methods of transporting these vaccines. So it is not yet to hurry. And keep in mind that a number of Pfizer is looking forward to. Okay, let me give you an idea of the bookings that they have so far. I want to read it also from here. Pfizer and BioNTech's vaccine, like almost all others in clinical trials, requires 2 doses. So that means that anybody who is going to be vaccinated is expectedly going to get 2 shots. You get one, and as well as a booster dose, okay, for it to be effective. In the summer, the companies began...
Okay, let's say Adeloju is calling. Adeloju, good morning.
Good morning, Trinity.
Yes, sir. How are you doing?
Good morning, Adeloju.
Yeah, go on.
Well done, sir.
Yeah, thank you very much.
Yes. We are quite familiar with the measures to put in place to ensure that one guides against the pandemic. But surprisingly these days, it seems people are now trying to shy away from those things that should be done. But I don't know, what can government do not to really place the lockdown again that can be done such that people would not still go back on lockdown? I don't know. What else can we do?
Thank you very much. Thank you very much for that very fine contribution. What can government do?
Outside the lockdown.
What do you think they can do? No, to enforce people.
To wear the mask.
To adhere to public health measures. What do you think can be done?
No, for me, doctor, I think the government is actually doing a lot. But, you know, the thing is,
what more can they do?
What more can they do is they've enforced it. I think I see event centers, as a matter of fact, speaking for PEPT, we had to do a voiceover where we said they have to, you can't come in without your mask. They, fumigated like everywhere and all of that. So for me now, speaking for us as individuals, I think it has to do with us, not even with the government. Because the government, they give us facts and figures every day. They've told us measures to take and all that. But then they can't enforce people, to do all of these things.
So why can't they enforce people?
Would they start arresting people? Okay, there was a time they started arresting people with, without mask. But then they stopped. But what I'm saying is, it's just okay for everybody to get tired at a point. Now, they can't, because when they say, okay, do this, you guys refuse to do it. Do that, they refuse to do it. How many people are they going to arrest? How many people are they going to persecute? So right now, we have to start doing it as individuals. Because I feel If I wear my mask, Dr. Bat has his mask on, Dewumi does the same. We'll keep preaching the messages like that, okay, if you don't protect yourself, you're actually going to affect me. I think we'll start understanding the importance of this, because it's so sad that now these days you go to the market, even when you have it on, some persons will tell you to remove it if you want to talk to them because they cannot hear you. Or you could even start feeling like an outcast if you go out here like this, and then you see other persons without... you see other persons in that way, and then you start feeling some type of way because you're looking odd in the midst of every other person. So I don't know what else the government can do, because I feel they've done their best.
Yeah, you've done so well. But I think, like the caller said, Adeloju said, more needs to be done.
Like what?
Yeah, I think the government will need to do a lot more to enforce these measures. For instance, supermarkets, worship centers, okay? There should be a routine visit to some of these places. Okay, in Nigeria, what we'll hear more is when people are penalized for any particular offense. Okay, so they can be making occasional trips to some of these centers. By the time the newspaper houses publish that so and so place has been shut down on account of not adhering to public health measures against COVID-19, people will sit up.
But then, doctor, there was a time they did.
But of course, you saw that when they did, a lot of people were on top of our game.
But I think I don't know why it's always so difficult.
Okay, but it's not. We're not seeing that anymore, and that is why people are dropping their guards. Okay, so but I think government needs to do more. Yes, we have to revisit that, because if you look at what is going on, look at the first video we had today, talking about the measures you need to take before you can actually come down to Nigeria. In case of some people who are trying to come into Nigeria, that is a lovely package. Okay.
Doctor, but this has been on ground before.
But people need to be told. People need to know. People need to know. So I'm talking about this particular video. Now, if we don't do this, we'll start importing cases. I will shock you by dropping this here. Some new mutants have been found out, and these ones have been found out, and the scientific community are actually saying that they can spread faster than what we were dealing with. So you have mutations ongoing at the moment. So as it is happening in other countries, if you have, we are as strong as our weakest link. The world is a global community. Okay? So you discover that people can travel from point A to point B. They can easily import this infection. They can easily import even the newer strains that are said to be a lot more deadlier and that can actually spread faster. So we need to keep preaching the message, and of course government needs to do more. If they have to use force, I think it will not be out of place.
No, it won't be out of place, okay? Because we still have a long way to go.
Yeah. Now, coming back to the BioNTech vaccine, the Pfizer vaccine is a breakthrough, is a major one, but I can tell you that as it stands, the richer countries of the world have actually booked ahead of time. Okay, so you now begin to wonder, when will we get to places like Africa?
Africa.
We may not even see anything probably towards the end of 2021 in this part of the world, except something drastic is done. Okay, I'm also happy that WHO is making constant efforts to see that when these vaccines are available, it will be equitably distributed. Are you laughing?
No, I'm not. I am not laughing. When we know how expensive it is to even get tested, how much more when we now have a vaccine, doctor? Yeah, you know this. That was why I asked. More reason I said I didn't really want to talk about the vaccine. But anyway, I think I'll have to talk about when I come from this break. So guys, please stick around. We are still very much on the pandemic. Doctor and myself, will they come back?
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, There are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
Babarisi, you been dey sleep when government motor show for inside area this afternoon. No, now so them take enter Sisi Clara house where dey the other side. They come comot with some kind medical equipment. But it be like say she don't catch the coronavirus where people dey yarn about. Oh, itself we no safe for inside area again. No, kai, I no go even pass that house again.
Mama Risi, haba. Sure you no know say they good make government to check everybody where they suspect say they don't contact with people who don't carry the virus. You know mean say they get them now. Even if to say the person get them, it means say they go just carry them, make he collect treatment. If person get the coronavirus, you know mean say the person don't die. Person fit still recover. Or when they don't suspect say somebody get them, then go do tests. Then fit even treat the person fast. Plenty people will catch the virus. After they collect treatment, then recover. When these government people come, make we allow them, make them test you.
This message now from the Federal and State Ministries of Health, Ministry of Information, NCDC, and them partners them.
We all know wearing a face mask is not very comfortable, but the risk of getting infected with coronavirus is much higher when you are in public without a face mask. Ensure your nose and mouth are covered properly while in public places or in a closed area with several people. Wash your hands regularly and maintain social distancing. You are not at risk of getting infected from people who have recovered from the virus. Do not stigmatize against them. Stigmatization increases the chances of community transmission of COVID-19. Remember, anyone can get infected. Together, let's fight COVID-19. This message is brought to you by the Risk Communication and Community Engagement, Public Health Department, Health and Human Services Secretariat, FCT Administration.
Hello? Tunde, it's been ages.
Maka, I'm so tired of this coronavirus pandemic. I am inviting you to my birthday bash next Saturday. All our friends are going to be there.
Wow, that is awesome. But I'm sorry. You know my condition now. I am managing and I can't risk corona.
Amaka, you're even too much. Corona cannot affect young people like us.
That's not true. Coronavirus affects young and old people, especially those of us with underlying health conditions. We must be very cautious. I know families who have lost their young ones too.
So this coronavirus is real. I am calling off the party.
Even young people are at risk. Be like Amaka. Do not take risks. Wear your masks correctly if you go out. Wash your hands regularly. Maintain physical distancing. It is better to do over syllabus than to regret.
This message is from the Ministry of Health, Ministry of Information, NCDC, and partners.
Everyone has to wear a face mask to reduce the spread of COVID-19. Wearing face masks appropriately can help prevent the spread of COVID-19. So the more you wear your face masks, the better. Whether you are on your way to work, the market, or the bus station, always wear a face mask. When an infected person coughs, they spread tiny droplets filled with the virus into the air. Wearing the mask helps to reduce the amount of virus being spread by an infected person. When wearing a face mask, make sure it covers your nose and mouth. You do not wear it on your neck or under your chin. Avoid touching your mask often. Dispose of it hygienically. Face shields will not protect you from COVID-19. Avoid wearing them. If you must, always wear it with a face mask. Take responsibility. This message is brought to you by the Presidential Task Force on COVID-19.
If after all these things where Dr. Ba don't talk, if after all these videos where we don't take our time to play, you see talk say you won't do on your own way.
You won't do over syllabus.
You won't do over syllabus. No, doctor, you can't do over syllabus. So
Okay,
if you do over syllabus, it's good. It's actually better. Under syllabus, now you won't do. Then we are not responsible to anything we happen. But we love you so much. That's now why we did do all of this. All right. So we say they take calls. But obviously, I guess return back to Dr. Ba. So I'll continue.
Yeah, thank you very much. Okay, so
let's talk about the vaccine.
Yes. Let me go back to the New York Times coronavirus vaccine tracker. Okay, at the moment, this was updated on the November 13th. Okay, so at the moment, we have 87 vaccines at the stage of preclinicals. And of course, 54 vaccines are currently at the stage of clinicals. Now, let me explain what that means. Preclinicals are vaccine trials that are not yet, that have not gotten to humans. Okay, what happens is that the journey of a vaccine actually starts from the lab. Okay, when they think they have an improvement, they will try it on animals, usually mice and monkeys. Okay, so that is the stage that is regarded as preclinicals. But when it gets to human trials, it is now called clinicals. And of course, you have phase 1, phase 2, and phase 3. Okay, but to shorten and then to hasten up things, the US actually did a project that they called Operation Warp Speed that the president was talking about on Friday that has enabled them to increase the speed. Okay, ordinarily, before now, we do know that it takes years, many years.
How long does it take for us
to develop a vaccine? It takes years to develop, oftentimes over a decade to develop one vaccine. But because of the ravaging nature of this pandemic, a whole lot of things have to be the speed has to be increased. Okay. And what government did was to ensure that some of these pharma companies were given monies upfront to facilitate things. And of course, that is paying off today. So at the moment, we have 39 vaccines in phase 1 clinicals. Phase 2 has 16 vaccine candidates. Phase 3 has 12 vaccine candidates. And the ones that have achieved or have gotten limited emergency authorization or approval at the moment are 6 in number. And of course, this does not include the almighty vaccine from Pfizer and BioNTech.
Doctor says almighty.
Yes, because that is the best we have seen now in terms of effort. Okay. That is not to say that.
Wait, doctor, you say in terms of effort, it is not like it has been tested.
It has been tested. Okay. But usually what happens is that after a vaccine has gotten to that stage, the manufacturers will put out their own data. People will look at it, but it has to be peer reviewed, by the scientific community. What they put out, others will have to take a look and do their own reviews. Okay, that is when all of that have been done, that they can now go for a formal approval. So at the moment, no vaccine has achieved that formal approval. Okay, so approved is still 0, but limited approval, there are 6 of them that have achieved limited approval. And then let's look at those that have achieved limited approval. Okay. Number 1 is the Chinese company called Casino Biologics developed a vaccine based on adenovirus called AD5 in partnership with the Institute of Biology at the country's Academy of Military Medical Science. Okay, so China has a number of vaccines that have achieved emergency authorization. I think they have about 2 or 3. Okay, so Casino Bio has one that has been approved. I'm talking about limited approval. And of course, one of the first, I think the very first that we actually heard about was Sputnik, the one from Russia. As a matter of fact, the scientific community actually were not comfortable when that announcement was made, because the announcement was made at what they considered a rather premature stage of the vaccine development. It was actually at phase 2 when the approval was gotten. It hadn't gotten to phase 3. It was long after it has been approved that eventually got to phase 3. That's the one that was produced by Gamaleya Research Institute in Russia. Okay, they named the vaccine Sputnik. Okay. On August 11th, that was as early as it got that approval, President Vladimir Putin announced that a Russian healthcare regulator had approved a vaccine renamed Sputnik 5 before phase 3 trials had even begun. Okay. Now, this vaccine at the moment is undergoing trials in a number of places. The trials are ongoing in Russia. People have been recruited in Belarus as well as UAE and Venezuela. Okay, so these are places where these vaccines are undergoing trial at the moment. Other places where the vaccine are undergoing trial, let me read what I have here. On September 4, 3 weeks after Putin's announcement, Gamaleya Research published the results of their phase 1/2 trial. In a small study, they found that Sputnik yielded antibodies to the coronavirus and had mild side effects. Meanwhile, Russia had negotiated agreements to supply the vaccine to countries including Argentina, Brazil, Mexico, and of course, India. So there's another one that's been approved, okay, for early use in Russia. So Russia has about 2 now. It's called Bectop. Okay, the approval was gotten on October 14th. And then there's another vaccine candidate that has achieved that approval as well, approved for limited use in UAE. The Wuhan Institute of Biological Products developed an inactivated virus vaccine, which the state-owned Chinese company Sinopharm put into clinical tests.
Okay, Doctor, I think we should continue from here next week because we
Is
need
our
to
time
sign
up?
Now. Yes.
Wow.
We'll continue from here next week, right?
Yeah, thank you very much.
All right. So thank you guys for joining us again on the show this morning. Dr. Bat will be on ground next week, Saturday. We love you guys. Stay
And don't
safe.
forget to keep staying safe.
Please stay safe. Oh, thank you.